So Rachel, okay, let's talk for a minute with Rachel about Rachel's Remedy, and let everybody know about your fabulous product.
Oh, I would love to. Well, when I was nursing my first child, I have two boys, now 6 and 4, which is hard to believe because I feel like I just gave birth to them yesterday.
Uh-huh.
And I experienced really painful clogged ducts, and they would be recurring, and the treatment was always the same from my IBCLCs, from my doctors, and it was always moist heat, which was so hard for me to apply, because I was needing my hands, and the only way to do it was to take several hot showers or baths a day, which
Yeah.
I was so lucky to even take one, and I know you moms know exactly what I'm talking about. So time was always an issue. The hot washcloths they drip everywhere and get my clothes all wet, so that was really awful. And then I had a doctor tell me I should lean into a bowl of water on my kitchen counter and just sit there, like, oh, okay. So that kind of drove me to the brink of insanity.
It's called a boob bath.
A boob bath, right? In my kitchen with my neighbors, just gonna lean in here all day.
Uh-huh.
And then several times my clogged ducts turned to mastitis because I couldn't properly treat the clogged ducts with the moist heat because I didn't have the time. And I just didn't have the hands. I mean, when I was taking care of my kids, I could not take out 20 minutes to hold washcloths in place. So I invented Rachel's Remedy, and it's a moist heat pack, and it's wearable, and you can wear it right in your bra, and your clothes stay dry, and moms stay hands-free, which is worth gold in my opinion. And it's an all-natural product, and I really wanted to make something that moms felt comfortable putting near their breast milk because, of course, moms are really worried about that. I was. So it's a flaxseed-filled pillow, and that goes into the microwave or the freezer. It can be used cold. And then it goes inside this waterproof pouch, and that's what keeps clothes dry. And it also protects the flaxseed, because anytime you're putting something near your breast milk, you never want it to get contaminated with milk, because then it could grow bacteria, and you want to have something washable. And that's really important, especially if you're going to reuse it. And then it has this removable organic cloth that goes under hot water.
Show them what it looks like here. That's the cloth that comes off.
Yes. And it goes under hot water, reattaches, and then that's what goes against your skin, and then you wear it right in your bra. And it can be worn before pumping, before nursing. It helps to encourage letdown, increase milk supply, helps to treat clogged ducts, prevent mastitis. So it does all these great things, and it's wearable.
Yeah, really awesome. A lot of people don't realize that there's a difference between dry heat and moist heat, and this will actually give you the opportunity to use the moist heat within your bra and not get yourself soaking wet, like Rachel said. And I just think that's such a unique, wonderful product. I love it, and I just love the whole idea. So, and it does come with 2, because you need one for each side. So the package has 2 in there. So yeah, and then I also want you to quickly tell them about the new nursing pads that are coming out, because there's something special about them, and they're brand new. So first of all, can we get some hearts for the Rachel's Remedy before she talks about her new nursing pads?
Oh, thank you.
Yeah. Go ahead. You could go ahead. There's a little bit of a delay, but then we're going to get hearts here.
Okay, we love these nursing pads so much. They are not out on the market yet. The breastfeeding relief packs are. You can get these at Target, Babies R Us, Amazon, of course. But our awesome nursing pads are not on the market yet. They're going to be very soon, and Shari will probably be the first to announce it. But what makes these so special, there's organic Sherpa that goes against your skin, and they also have silver in them, and silver ions help to prevent bacteria and the growth of yeast. So it's an antimicrobial, and it's amazing. They're so soft and they're so absorbent. So we'll be the first ones out there with these silver ions in them, which will really help prevent that yeast from growing, which is always an issue when milk is sitting there.
It's such a huge thing. I wanted you to talk about this because there are different nursing pads, and I'm a huge advocate of washable nursing pads, like wearing cloth, not wearing paper 24 hours a day. It's a conversation for a whole other night. When we talk about cloth diapering and everything, which we will, this kind of stuff will come up. But the idea of wearing paper against your skin is not the best thing. It's good for when you go out, but I would recommend, especially for new moms and anytime you're home, when you're sleeping, to wear washable pads. It's one of those things I always put on my list of recommended products for, like, what do I need as my necessities? Some washable breast pads would be it. And the silver that's inside of here, as Rachel was describing, the antimicrobial properties of that is super important because the yeast will grow on it. It's very hard to wash it off. You want them to, as you can imagine, this is something that's going up against your skin. Lots of times, especially in the beginning, you might have some cracking of the nipple, and that's where bacteria enters into the nipple. That's how you wound up with mastitis or bacterial mastitis, is from where bacteria can enter. And so it's really important to make sure that we're keeping that area very clean.
Right. Thank you.
Awesome. Yay. I'm so excited. And like she said, I'll be the first to announce that they're ready because I'll be like, are we ready to go yet? So who's excited about this? Who wants to get some of these or anything that we just talked about because it's part of the prizes? And let's see some hearts go across the screen. For everyone who's new, I want to explain the rules of engagement around here. When we answer a question, when we show you something, when we offer, we get the hearts back because we love to know that we know you're awake. Otherwise, I don't know. So we always love to see hearts. You go ahead and hit your little heart button there. Give us some love. It makes me keep going. I don't know. You guys are seeing this now, what it's like to talk and then see the hearts fly across. It makes you more encouraged to say more. If you'd like me to say more, if you'd like me to answer more questions, then I need lots of hearts to go across the screen, and then I will keep on talking. All right, awesome. Great job, ladies. Thank you so much. I'm going to keep you on with us, okay? And we are going to bring on our first live with you mama here, okay, to ask her question, our first person to come on. And you guys, this is like one of you guys, all right? And you can do this next time. A few of you posted your questions and said that you're a little too shy to come on camera. Totally fine. You don't have to come on camera. You can still submit your questions and I will answer some tonight. But for those of you guys who said, I want to do that, I'd like to be live, we've got you here, okay? So I'm about to call on Angela, and you guys are gonna bear with me while I play with the controls here and get this figured out. And let's see. Okay, so hold on. We're gonna bring Angela on. She's gonna ask her question. Here we go. All right. So first, let's see here. Okay. All right, Angela. Angela, there she is. Hi, Angela.
Hi.
How are you?
Good. How are you?
Oh, welcome. Look how wonderful this is to have you here with us.
I know. It's so cool. I really like this.
Oh, so glad. And who do you have in your arms right there?
This is Nora. She finally sleeps.
Oh my goodness, she's so beautiful, so cute. How old is Nora?
She's 3 months old.
She's 3 months old. Awesome. Can we get some hearts for Angela to come on and do this with us with her little 3-month-old who is looking so comfy right there in your arms. She looks like she just ate. She does. She looks like she just ate. Awesome. All right. So is this working? I'm looking over on Facebook here to see how it's working. This is a great program because a great software. When I speak, I should be on the screen. And then Angela, when you speak, you should be on the screen. So I'm going to go ahead and let you ask your question and then we will just chat.
Okay. Well, for 3 months now, I've been breastfeeding her and everything's been going very well. But recently, now that she started sleeping through the night more, in the mornings when I'm more full, I notice that the milk will shoot into her mouth a little bit too hard for her liking, and she kind of gags, and it just starts everything off terribly. So I wanted to know what to do to kind of relieve that pressure.
Awesome. Yeah, you'll notice that because as the milk supply increases, and typically this happens as a rebound effect from a growth spurt. So if you if this is happening for you, you'll notice that sometimes like a week before that, the baby was eating like frequently, maybe every hour, like constantly at the breast. And then how you rebound from that growth spurt is with a lot more milk. And that's what's supposed to happen, is that you all of a sudden become much more full, and especially first thing in the morning. It's all of us are more full first thing in the morning. Isn't that true, everybody? Can you all kind of attest to that, that first thing in the morning is when you have the most amount of milk? So you'll see that if it's going to happen, it's going to happen the way you're describing, which is, you wake up and the milk's shooting out, she's gagging, she's choking on it. And, typically it takes a couple days or a week or so for that to kind of settle down, and then you'll be back on your way again. The typical growth spurts are around 3 weeks, 6 weeks, 3 months, and 6 months.
Oh, okay.
Okay, and she's 3 months. It's not always exactly on those times, but she's really right on track for a growth spurt right now. And you probably either saw that because you went to pick her up and you're like, oh my God, you're bigger than you were yesterday. What happened? Like, how did that happen overnight? And that's that is how babies grow. I mean, it's funny because they don't grow evenly, especially breastfed babies. And it's one of those things where they go through spurts where they won't gain a lot for a little while, and then all of a sudden they'll just gain a lot all at once. But what do you do about it? Okay, so now we know why that happened, but what do you do about it? The main thing that I would say is stick to one side at the feeding. So don't try to switch right in the middle, even if it's kind of uneven, where you're mostly feeding just from one breast first thing in the morning, and you might just might be a good time to pump a little bit on the other side just to relieve some of the engorgement, to allow the breast to even out, okay? It'll also help her to get more of the hind milk, which is only really an issue when the breast is that full. And so it'll help to digest the lactose. It's a little bit more fat in it, and so it'll help her as well. As far as the gagging and the choking, you can express a little bit of it out. You can even do it with the hands. You don't even need to take out your pump to do that. Maybe right before you latch her, just take a container, one of the milk storage containers, and just hand express like a half an ounce or quarter of an ounce into the container. Do you know how to hand express?
I've never done it, so no.
Okay, it may be something good for you to learn how to do. All right, one of the ways, I mean, there are videos on how to do that, but basically what you're doing is you're taking your thumb and your forefinger, I don't know if you could see me, your thumb and your forefinger, and you're putting it behind, like on the, like almost like 12 o'clock and 6 o'clock of the areola at the edge. And you're pushing back into the chest wall and then pressing forward and holding it there without sliding your fingers. That's gonna start to get the milk flowing, okay? And then you just hold the container and you allow it to come out. You can use a hand pump too. You can also put on your electric pump. Just a little bit will take some of that initial force out of it and make it easier for her to latch and not gag and choke too much. The other thing you can do is something called laid back nursing with her, where instead of, you're nursing her in a cradle position where she's underneath the breast, you lay back and let the baby kind of lay on top of you to nurse. What that will do is give her more control over the amount that's going into her mouth so that she can control the feeding versus sliding underneath the breast and, being, hold on, the screen just changed and I got Laura now. So hold on a second. I don't know why. All right. So that way that she's more on top of you and you're not laying her underneath you. It'll be easier for her.
Okay.
Yeah, I think those things will help a lot. And just remember that it's kind of one of those things that passes too. Did you notice all of a sudden it started?
Yeah.
Yeah. And it's not all day.
No, it's just really in the morning and then sometimes in the evening, but that's really it.
Yeah. Okay. Yeah, it's usually just the growth spurt that causes that. Those two things will help a lot. And then you'll have a little bit of extra milk stored just try not to pump too much extra or express too much because you want it to go down. And remember, the more that you express, the more you'll continue to make. So it's not like just go pump a ton and then put it away because you'll never get over that issue.
Oh, okay.
Okay. All right. You're very welcome. Awesome. Thank you, Angela. Thank you for being our first person on here. You did wonderful. Let's get some hearts for Angela and baby Nora. So cute, who slept through the whole thing like a very milk drunk baby would do. Okay, very good. Very good. Okay, so I'm going to try now putting us on, let's see here. I'm going to mute. I'm talking myself through this, as you can see.
You're doing really well.
I'm doing well. Thank you so much, Rachel. I hope it's coming off doing well here. I'm trying my best.
I think so.
All right, awesome. Let's do this. Before we move on to the next guest, I would like to answer one of the questions that came in through the chat so we give everybody an opportunity. So just give me 1 second. Let me find a question that came in. All right, this question came in from Haley. Okay, Haley said, and I don't know if Haley's in the chat room. If Haley's in the chat room, just say hello. Give a little bit of a shout out, Haley, because I know you left this question. I want to answer it for you. Her little one was born September of this past year, and lately she's been sore on one side. She feels bruised and raw on the one breast, but the other is fine. This happened about a month ago, too. And she was prescribed the all-purpose nipple ointment cream, but here we are again, is what she's saying. Any ideas on what this might be? And, it could be so many different things. Without asking you more questions, the different, bruised and raw, is it the nipple or is it the breast? Let's answer both of them because I'm not really sure which one she's asking. If we're talking about your nipple, the couple things that it could be and why it could be returning, one of them that comes to mind when I read your question was something called a milk bleb or a plug in the nipple itself. So it's actually like a plug duct, okay, right there behind the nipple. Sometimes you can see it because it looks like a white, almost like a white blister in the tip of the nipple, and it's actually milk that's solidified in the pore of the nipple in one of the holes where the milk comes out. Sometimes you can't see it because it's just behind that area, but it makes the nipple very painful. And so when you talk about like this nipple's been very sore, and now it's back again, that's the first thing that's coming to my mind, especially if you're not seeing like cracking. And this can be really confusing for moms because you look at the nipple, everything looks fine, there's no issue there, you actually can't even feel anything, like if you massage around, but it's just so painful, and the latch can be super painful with no cracking at all. Rachel raised up her remedies there because moist heat is one of the best things that you could do for a milk bleb. And so what I would recommend to you is that before you move on to like anything else, I would try applying some moist heat. Rachel's remedy would be a great way to do it. But any kind of nice moist heat to that nipple, hold it there, apply it several times a day, and see if that starts to help even more than the nipple ointment, okay? Especially because you're talking about one side. That was the thing that kind of triggered me right now. More like a plug duct or something mechanical, if that makes sense, than bacterial or yeast. Usually when we're talking about yeast, you're going to see it on both sides. And so the nipples can be very sore, very red. They usually have a very shiny red appearance to them when there's yeast growing on the nipple, or pain in the breast, which would feel like shooting pains in between the feedings if you have more of a internal systemic, more of a yeast infection. This sounds more like a bleb or a plug duct that just keeps recurring. Some people are just more susceptible to that. So if that's the case, that's something to take a look at. One thing I would suggest is make sure that, we think we're nursing the same way on both sides. So sometimes it has to do with your latch and position. And of course we are more dominant on one side over the other. And sometimes our latch could look similar, but we're actually doing something a little bit different that's not allowing the milk to flow completely. It's causing plugged ducts, or maybe you're, maybe not in the nipple, but in the breast, if you're getting recurring plugged ducts in the breast, sometimes sleeping on one side where you're putting a lot of pressure on that one breast over and over. Like, I know I'm a left side sleeper, so I tend to always sleep on my left side. That would put a lot of pressure on the left breast. So pay attention to those things. Feel around for any kind of lumps. Make sure that if you have any plugs that you're working on them with moist heat, massage, and lots of nursing to keep it flowing. Some people just have thicker milk too, and lecithin can actually help with that as well. So that's a supplement that you could take. Sunflower lecithin's a good one where it can help with the viscosity of the milk, which means it makes it thinner. So if you have a recurring plugged ducts, it could be something to take a look at. I'm mentioning this to you because it may be something you're not considering. So
and those labs hurt so much. It's amazing that something that small can cause that much pain.
Oh my goodness. Yes. It's very painful. And you'll sometimes, like I said, you'll see it, and sometimes you won't see it at all because it's just behind the ability to visualize it. So, but either way, the moist heat, why moist heat is good is because it penetrates the skin.
Right.
Right.
That's so it's dry heat.
That's why it's better than the dry heat. Exactly. Awesome. Okay, great. Yay. Okay, hearts for Haley, who was unable to join us live, but left her question. And I think it was a great question for so many people who are probably experiencing the same thing or something like it. And I hope that helps you. And I hope you post back to me to let me know if that worked. But lots and lots of hearts and love. Okay. Awesome. Yay. We got a lot of great people. And you guys can post your questions here in the chat as always. Don't feel left out just because we're doing something a little bit different today. I want to see those questions streaming. You know what happens? If you post your question here in the chat room, someone will answer it for you. All the ladies who are here are also in the chat, so they're going to be answering. Joe knows so much, so Joe will be in the other room. Joe could be a lactation consultant and a midwife at this point after 20 years with me, okay? So have these questions. The best part, I don't know if you guys know this, so for those of you guys who are new, a little bit of my background real quick. I've been doing this for 25 years. I was a labor and delivery nurse. I was a nurse midwife. I had my own practice for a long, long time. I delivered 600 babies in my practice. That was after thousands as a nurse, okay? So my background's really labor and birth. 15 years ago, when I had my first daughter, I struggled with breastfeeding. I opened a learning center and a retail store that sold all these products. Joe and I started working together at that point. And my specialty became more breastfeeding and teaching. And, it always made me laugh because Joe knew so much about all of this stuff from doing it with me and then doing it in the store. The best part would be when I would come out from the back in the store and there would be a dad and Joe. Okay, no, I'm not kidding, all the time. Dad and Joe standing in the breastfeeding section of our store talking about nipple cream and having this complete, conversation. And the dad was just so grateful to have Joe, who was so knowledgeable about which one was the best and why it was good and what you would use it for, and explaining how to support their wives. And I just used to hide behind their racks to watch those conversations because they were my absolute favorite conversations. And Joe's very knowledgeable. So I think we're going to be doing some surprise stuff coming up. Hey, Joe? Yeah. Joe said yeah for all the daddies, okay? Because you got you got an untapped resource that hides in the other room that we're going to be, here he comes.
You call me out.
All right, I'm calling you out. Come on out for a minute.
Hey, everyone.
Hi, Joe.
Hey, Rachel. Hello. Angela, you did awesome. High five. So who you're listening tonight is the most amazing expert, right? And when we first had our daughters, she was medically trained. She delivered so many babies, and everybody looked to her like she was the expert. And she did have an incredible amount of knowledge and experience, but yet becoming a parent, it's a whole different experience, you know, and you have your own experience, and then it changes everything. And because of that, you know, really put us on this path. So we wish we had the knowledge you're getting tonight. This has been from years and years of like Shari. You don't even know how much time she's put in to try to learn everything she's learning, but she makes it so simple and fun. So it's our dream that came true with having the internet and the ability to reach all you and support you. And
you guys are helping so many people.
So many people, and you guys are doing it too. We see you supporting one another, and you're sharing it. I noticed, and Shari notices when you tag your friend, when you share the post. That's like spreading the love forward. That's, you know, there's another mom or dad out there that needs the help, and that's so awesome that you're being so generous. Aside from the awesome prizes and stuff like that, we're really making a difference, and you guys are at the heart of it. So, catch and chat.
Thank you, Joe.
And there will be some stuff coming for dads.
Yes. Joe promises some stuff for dads. How wonderful is that? Yeah. Yeah, he's making me feel, now I'm like, okay, I'm all. No, it is wonderful to be able to do this with so many people, because we used to do it in our learning center, and then we'd be just thinking to ourselves, God, there's so many thousands of parents who need this information. Thank God we found a way to bring it out there and to expand that. So we're very grateful for the internet, for sure, and for Facebook to be able to do this. Yay, wonderful. Lots of hearts. What?
I said, yay, hearts.
Yay, hearts. Hearts, hearts, hearts. Lots of hearts for Joe. Joe deserved hearts for that, for sure. Thank you, sweetheart. Okay, let's bring Casey on right now to ask Casey's question. So hang on a second, guys. Here we go. Ready? Here comes Casey. Hi, Casey.
Hi.
How are you?
Good. How are you?
Welcome. Welcome to the chat room.
Thank you.
And who do you have in your arms there? I see
this
little
is Mackenzie.
Hi, Mackenzie. How old is she?
She will be 2 months old on Monday.
Oh, my goodness. Congratulations. Awesome. So, Casey, what was your question?
So I am nursing and pumping, and I've noticed that she's been getting more and more gassy and uncomfortable. So I was thinking about trying an elimination diet, but I don't know how long I should be eliminating something for to know if that's the culprit or not.
Okay. Such a good question, because I talk to moms every day, and they're eliminating so much food from their diet because they're assuming that it's something that they're eating that's causing their baby to be fussy and gassy. And I have to tell you, Casey, that it is very rare that it's something that you're eating that's causing the baby to have a reaction like that. And typically, if it is something in the diet, you'll also see some other symptoms. It's not just fussiness or gassiness. It'll typically be a rash, or you'll have bloody, blood in their stool, or green stool, something that's causing an irritation of the bowel. Sometimes you'll see eczema, other things, or congestion. Okay, those are all signs of a food reaction, because it's one of the things that's so over-diagnosed and so overlooked at. And then you'll hear moms talking about, like, they're hardly eating anything. They're going down to almost nothing, and it's still not curing the problem. And if anything, it's making things worse, because you're not getting all the nutrition that you need. It's making breastfeeding miserable because you can't eat all the foods, which you should be able to eat all those foods. Most foods that you would consider that would make you gassy don't go through your bloodstream into your breast milk to make your baby gassy. So, for example, if eating broccoli makes you gassy, it's not like you eat it. It gets digested, and broccoli goes right into your milk. It doesn't go in that form. So it doesn't cross over in that way, okay? But some things do, and I've said this over and over again. The number one thing to look at, if you really do think that it's something in your diet that's causing it, The number one thing to consider is dairy.
Okay.
Okay. And that means all dairy. So cheese, milk, cream, ice cream, all those things. The reason why dairy would be different than some of the other foods, and it's one of the, it's like sometimes the last thing that moms cut out, they'll say, oh my God, I'm eating nothing except, and then I'll say, well, tell me your diet. And they're like, oh, well, I have a bowl of like cornflakes in the morning with milk. I eat nothing else. And I'm like, yeah, that's the thing doing it, because dairy, cow's milk has proteins in it that are different than human milk. Okay. And those proteins in the milk will actually pass through your breast milk and go to the baby. Now, remember, human babies were never meant to drink cow's milk. All right. That milk was meant for baby cows. And so many babies, in fact, I think half the babies out there really do react in some way to cow's milk. That doesn't mean that they have a cow's milk allergy. They have what we call an intolerance to cow's milk, especially in the early, months. It can last up to 3 years old, but usually by around a year old, they grow out of it. When you think that you may have an intolerance, or the baby may have an intolerance to something that you're eating, like dairy, it can get, let's say this, it gets into your milk within about 4 hours. So quick from eating it, but it can take weeks for it to come out.
Okay.
All right. So it could take up to 2 weeks for it to come out of your system, and then even another 2 weeks to come out of the baby's system. So we're talking 3 to 4 weeks of cutting it out of your diet before you can even really tell, was that the culprit?
Okay.
All right. So, people will try, well, I didn't drink any milk yesterday and the baby's still gassy. That's not it. You've got to really do it for a long time. And sometimes dairy is hidden in food. So there's, and I would go online, there's some good lists of you've got to look at the ingredients for the casein, for different things that are actually hidden in foods that you would not consider dairy, but they're there. And you go, I've been cutting it out, but my baby's still having that reaction. If you really are having that, then the baby, it needs to be cut out completely, and it has to be for weeks before you can actually tell the difference. All right. If there's nothing else except fussiness, then I would actually start to think about something else before I would go right to an intolerance, to a food intolerance. If the baby's, how are her poops? Are they green? Are they yellow? What do they look like?
They're pretty yellow. Okay. Pretty normal.
So, the fact that she's got normal poop, which is normal for a breastfed baby, should be like, and diarrhea is not, they're supposed to have very watery poop when they're breastfeeding. So, but if it's yellowy and it's seedy, that's normal. And very typically, if they're having some kind of an irritation to their bowel, you'll see that their poop turns green pretty quickly. So I would say that that's probably not what's happening. Tell me again, she's how old? 2 months old?
Yeah.
2 months old. So, was she born a little bit early?
No, she was induced on my due date.
She was induced on your due date. Okay. So one of the things that happens, and we talked about this recently on a prior episode, I think it was like 2 weeks ago, we did that whole show on calming your fussy baby. Do you remember that? We talked about that fussy time between 2 weeks of age, 2 weeks past the due date, and 6 weeks past the due date, and then it starts to resolve, but it peaks around 6 weeks. And not all babies are going to do it at the exact time, but it could be that your baby's just hitting a peak of fussiness and ready to turn over to the other side, hopefully, and start to get less fussy. That could also be a growth spurt that's causing it. It could be teething that's causing it. It could be not burping frequently enough that's causing the fussiness. It could be like what Angela was talking about. She's rebounding from a growth spurt. Now she's got all this extra milk. It could be that you need to burp more frequently. And it could be that you have to do it several times during the feeding, not just at, halfway through when you switch sides or at the end. It might be more frequently. Go back and watch that episode again on calming your fussy baby. That would be my recommendation, especially to the parts where I talk about the different signs to look for to know that your baby needs to burp. I can't tell you how many times fussy babies, we've cured them with just recognizing those very subtle, nuanced signs that they actually need to come off the breast and burp. And it's just like sometimes just a little pull of the head. Like they go to nurse, and within a minute of latching, they pull their head back and then they go back. That was a signal that they need to come off and burp, and you missed it. Okay. And now that tiny little air bubble that should have come out with with my burping method. Everybody saw the burping video, right? Okay. Mm-hmm. You burp the baby, the little bubble comes out, and now instead of having it comes out, it's done. Instead of now, if you don't do that, that little bubble, it takes hours to travel through their intestine, and it hurts. Think about when you have gas pain. It's sharp, it hurts. It's just that little air bubble. So before you start cutting all this stuff out of your diet, including dairy, I would try some of these other things. And then if you start to see other signs like green stool and, inconsolable crying and waking from a dead sleep, even though you've been burping frequently, then you could start with dairy.
Okay. Perfect. Thank you.
Does that answer your question?
Yes. Thank you.
All right. Awesome. Thank you so much, Casey. Thank you for joining us.
No problem.
Oh, okay. Hearts for Casey. Hearts for Casey. Yay. Oh my goodness. We've had some really good shows recently, really good topic shows that have been so much fun, like the Calming Your Fussy Baby, the nursing bra one that we did, the baby wearing that we did, some really great stuff. So we have these nice, great Q&As where we can ask our questions. And then I'm trying to do some little classes, which if you guys been enjoying the classes that we've been doing, where, going over all the content, and I hope that you're getting a lot out of that. I love doing those. We have a really special one coming up really soon this Wednesday. Okay. I think you guys have all seen the advertisement for it. It's on lip and tongue ties with a really amazing doctor, Dr. Scott Siegel, who is a physician. He's an MD. He's an oral surgeon. He's a dentist. He's like the top guy. And all he does is specializes in lip and tongue ties. And you guys have had a million questions about this. And I really wanted to get you the top person in here to answer those questions, to have a conversation, because so many people are underdiagnosed when they really need to be dealt with and handled, and they're losing their milk supply. And I just wanted to get somebody good who can really give you the information. He'll be here with me on Wednesday night at 9 p.m. for that special episode. Of course, everything is recorded so that if you miss the live episode, which we would love to have you there because we'll be taking questions with Dr. Siegel, but if you miss it, it'll be on my wall to watch at any time after, okay? So fantastic. We're going to move on to other people who are in the chat room who are waiting in line here. We've got Nellie, and I'm about to bring Nellie on for her question. So let's get some more hearts while we're doing this so I can see the love while we're bringing Nellie on. All right, here we go. Nellie's not unmuting for me for whatever reason. Let's see. Huh. Oh, there we go. Okay, good. Did Nellie just join us? There she is. Hi. Hi, Nellie. Hi. How are you?
Good. How are you?
Good, good. Who do you got there with you?
Her name is Mila.
Mila.
She's just waking up. So.
Oh, my goodness. Oh, she's a new one. How old is she?
She just turned 4 weeks.
Oh,
she's a month old.
All these little girls. I have 2 girls, too. I love all these little girls. Congratulations.
Thank you.
Oh, how wonderful. So how wonderful is this that we get to see you, and we get to celebrate you and your new baby, and we get to answer your question live, and I get to see your face as you ask me directly. So go ahead and ask me your question, and hopefully I'll be able to answer it for you.
Okay, so we've been struggling with breastfeeding now for a couple of weeks, and my question was, is there a way naturally to help bring in more supply? And if so, once your body kind of regulates, I've only been pumping about half an ounce or maybe an ounce a session. Does that mean that that's all that my body's going to produce eventually?
Okay. Let me ask you a question, Ellie. Are you exclusively breastfeeding her, or are you exclusively pumping?
I'm doing a little bit of both. I'm nursing her, but I'm also having to supplement a little bit, just because I'm not producing enough, or it doesn't feel like it. She's constantly hungry.
Okay. So let's do this. Let's talk about what sometimes the question that you're asking is not the answer that I need to give you. So I'm going to go for what the answer may need to be versus what you think it may need to be.
Okay.
So here's what I want to say to you. When you say you're supplementing after the feeding, you're supplementing with what you're able to pump out and give her in a bottle. Is that what you're saying? Or are you formula supplementing?
Yes, with myself.
With your pump.
What I'm pumping. Yeah.
Okay. And the reason that you're doing that is because when she comes off the breast, she's still crying, looking for more. Is that what you're saying?
Yes.
Okay. Tell me about how many wet diapers is she having in a 24-hour period?
Oh my goodness, a lot.
Okay.
Yes.
All right. So here's how I'm going to answer you, okay? When anybody says to me, I don't know if my baby's getting enough because they come off the breast and they're still crying and I think I'm not making enough. And then I ask the question, how many wet diapers? And they say, oh my goodness, I can't even count. My answer to you is definitely not a milk supply issue.
Okay.
Okay, this is not a milk supply issue. And actually, it could be an oversupply issue. Now I'm going to shock you with that one, okay? So where you thought that you might not be making enough, it could be that you're making more than she actually needs, which is very normal 1 month into it, that there still could be some engorgement. The fussiness and the crying when she comes off the breast is not necessarily hunger. And anybody who's watched my program, I have the program Simply Breastfeeding, my online breastfeeding class, which was actually the class I used to teach live. A lot of people here in the chat room have taken that class. I talk about the 4 ways that you know your baby's getting enough. One of the things that, the thing that you're looking for, okay, is you're looking to see that your breast feels softer after the feeding. So when you feed her, can you feel that your breast feels softer after you're done? Yep. And then you're also listening for swallowing. So can you hear lots of swallowing when she's on the breast?
Yes. At first I didn't know what that was, but yeah, I am.
Then you start to get the sound of it. It's like a in the throat swallowing. And then you're also looking for at least 6 to 8 wet diapers in a 24-hour period.
Okay.
Okay. And if it's more than that, then she's getting a ton.
Okay.
Okay. And then the last thing of the 4 ways you know your baby got enough is that your baby is coming off and is satisfied. And that's the one that throws everybody off, because then the baby comes off crying and you think it must be hunger. It's the first thing that everybody goes to in your mind. If the baby's crying, she must be hungry and it must be my milk supply.
Right.
But really, it could be that she's getting too much, that there's a lot of fore milk, so that you may be switching sides too quickly where she's not actually getting to the fatty milk behind because you're so full. All right. Okay. It could be that you're not burping frequently enough. That's causing her to feel that gassiness inside. Okay. And it also could just be that she wants to suck, because babies love to suck. So you'll notice that she comes off the breast. She seems like she's falling asleep, so you take her off, but then she starts to cry. Then you think she's hungry. You put her back on the breast. She doesn't really start eating again. She sucks and falls asleep.
Right.
If you put her back to the breast and she goes back to eating and sucking, then she's hungry, okay? If she goes back and falls asleep, it's a really good sign that she wasn't really hungry. That's not what the fussiness was about, because a hungry baby will eat. So you'll see that she's sucking really hard and there's no milk coming out. That's a different sign. That's not what you're experiencing.
Okay.
Does that make sense to you?
That makes sense.
Okay.
Yes.
Also, when you're looking at all those wet diapers, it's coming from somewhere.
Right.
Okay. And so if there wasn't enough milk going in, it wouldn't be coming out. And it doesn't happen over days. Like, it's not like she peed a lot today, so maybe she ate a lot earlier in the week, but today I think my milk supply is low. When you drink a lot yourself, you don't pee like days later. You pee that day.
Right.
Okay. So when your baby's peeing a lot, that means that you're giving your baby a lot of milk right there in the moment. that day, they're getting enough. And so I would say that regardless of how much she's crying, if she's peeing a lot, there's no immediate risk. There's no immediate issue. You know it's not a supply issue. And actually giving her more milk by pumping, you could be actually creating more of an oversupply right now by pumping that extra ounce. The fact that you can get an ounce out after you feed tells me that you make a lot of milk.
Okay. All right.
Does that make sense to you?
Yes.
Yeah, you're working on the wrong issue. It's actually probably the very opposite, and you could be creating it by doing that. If my advice to you right now would be to stop all pumping, okay? To put the baby to breast, to feed as frequently as the baby wants to eat. Will she take a pacifier?
Yeah, she has one right now.
Okay, good. And she likes to suck on it?
Yes.
And does it calm and soothe her when she takes that pacifier?
Yeah.
Okay, there's no milk coming out of it.
Right.
Right? So if she was hungry, she would be pissed. Okay? And it's a really good way to judge it, that if she takes the pacifier and she's happy with it, she just wanted to suck. Sucking is a really strong need for a newborn, for a baby. It's a reflex, and it's a life-sustaining reflex. We're happy that they want to suck all the time. That's what gets them to eat and gain weight and survive. So they need to suck. And you know, I have no problem with a pacifier, especially with a baby that's eating the way she's eating. Pacifiers are fine for breastfed babies. They can go back and forth between them. And what I would suggest to you is don't substitute the feeding with the pacifier. But if you know you put her back to the breast and she's just going to sleep, she's not really eating, you can try the pacifier just to get a little extra sucking in.
Okay. Sounds good.
But I would stop pumping. I would stop pumping and only watch those wet diapers and burp a lot.
Okay.
Okay.
Thank you.
You've made a lot of comments before, Shari, about the misconception of filling an 8-ounce bottle with milk, because so many women think that's what they should be able to do.
Totally. You know, I posted, did you guys see that graphic I put up this week with the bottles? It had like 400 shares on that. Everybody's going, oh my God, you know, look at these bottles, because so many people have the same misconceptions about how much a breastfed baby is supposed to eat. And it's such small amounts, really. I mean, and I don't even like to quantify it, because the truth is, Nellie, if I said to you, you know, put her to the breast and feed her 2.5 ounces, you'd be like, yeah, but how am I going to know? I can't see it. And the answer is because you're not supposed to know. And that's why the 4 ways that you know your baby got enough have nothing to do with how many ounces or how much time she's on the breast, like 20 minutes on each side, or it's all meaningless. We're looking for other signs, the ones I just talked to you about. And then you're also, and mainly those wet diapers.
Okay. Thank you very much.
Oh, you're so welcome. Congratulations. Good luck to you. You're gonna message me and let us all know how you're doing, okay?
Okay, will do. Thank you.
Okay, big hearts for Nellie. Let's get hearts. Yay, hearts for the question, hearts for the answer, hearts for everybody all around. Is everybody enjoying this? Is this fun or what? I don't know. I'm having like the best time tonight. Maybe I'm just entertaining myself. I have no idea here, but I'm having such a good time.
I'm having a great time.
Are you having fun?
So much fun.
Isn't this great?
Love it.
I mean, it adds like a whole new dimension to like actually have everybody here. It's like so personal in a time when we are like, you know, everything's on the internet and we're just typing and we don't get to actually look at each other and look into each other's eyes and have that interpersonal real connection. You know, to be able to do this, my goodness, to be able to look at your face, Nellie, and answer your question and like, you know, be able to ask you a question back. This is amazing. So I'm actually.
And we get to see babies.
And we get to see babies. That's the best part. Right, Laura?
Yeah. I love seeing the babies. That's my favorite part.
I know. See, they're all sitting at home with their babies and we never get to see them. So now we get to see them.
Big.
We all have big babies, so we miss that. Right, Laura?
Yeah. Yeah. And I actually have a similar story, kind of on just to touch on the point that you were just talking about. when my youngest was little, I thought that she wasn't eating enough because she always wanted to feed nonstop. And it turned out that I was actually feeding her too much. So it does happen. It's surprising to people that, you know, you can actually produce too much milk. But I remember she was always wanting to suck. And so that was the way I would soothe her. And I remember taking her into the doctor's office, and I'm like, there's something wrong with this baby. She's like groaning, and she's clearly uncomfortable, and she wants to eat all the time. And they weighed her, and they were like, you are feeding her way too much. And I'm like, well, how is that even possible? I'm breastfeeding. Mm-hmm. And they said, no, she gained like twice as much weight as she was supposed to in that time frame. And they said, you have to stop feeding her. Mm-hmm. So how do you tell a newborn that she can't eat? But I just had to find other ways to soothe her, you know, like with the pacifier, or just trying to make sure that she was spacing out her feedings a little bit more so she wasn't, you know, eating all the time. So,
well, you know, and that's such a good point, Laura, too, because it's not, most breastfed babies are unable to they don't really overfeed at the breast too much, but sometimes they do, because when they're uncomfortable, they'll want to soothe. And if you do have a lot of milk, you will wind up feeding them more than they need to eat. And then that in itself is going to give them a stomach ache. So they're going to feel uncomfortable because they're overfull, they're overstuffed, it hurts. And then you think they don't have enough, but they actually had more than had too much. So it makes a lot of sense. Yeah.
Didn't think it would happen, but it does.
It does. It definitely does happen. It definitely does happen. Okay, let's bring on Jess, because Jess has been waiting in the wings here the entire time. So I want to make sure that we give her a chance to ask her question. Hold on one second. Where is Jess? Oh, there she is. Okay. Okay. Where's Jess?
Hey.
Hi, Jess. Thank you for being so patient and waiting for your turn here.
Thank you for letting me on.
Of course. Welcome. Now is your baby there too?
Yes, he's kind of asleep.
Oh.
His name is Alden.
Oh. How old is he, and what's his name?
His name is Alden, and he's 3 months.
And he's 3 months. Congratulations.
Thank you.
Tell me, what was your question?
I was wondering if when I'm at home, should I... Ooh, he's going to start crying now. If I should be pumping at the times that I would be pumping at work. Should I be doing that at home? Because I'm not making... It took me a week to start pumping enough at work for a feeding.
Tell me a little bit about your schedule.
I work 4 days a week, 10-hour shifts.
Okay. And so while you're gone, how many times are you pumping while you're at work?
I pump 4 times. If I can get in another one, I do. I try to pump as much as I can to bring home. I try to bring home at least 12 ounces.
Okay, very good. Excellent. And so go ahead.
I pump 3 ounces, but I just recently started pumping 4.
Each time you pump?
Yeah.
Wow, that's actually amazing. It's actually really amazing. Good for you. You're doing fantastic. And the fact that you're able to bring home that much milk over a 10-hour period, with using your 10 hours a long time to be away from your baby, to be able to use your pump so effectively while you're gone, to be able to be maintaining that kind of supply and pumping that much out. And the fact that you're taking your time to taking the opportunities to pump as frequently as you can, that's one of the biggest issues I think so many moms face, is that they can't stop frequently enough to do it. It's not so much that you're getting a lot at each time you're doing it. It would be better to do more pumpings and get less out of it than to try to like space it out and get a lot more. Does that make sense?
Yeah.
So when you ask me, the question is, when you're home on your days off, should you continue to pump or should you feed? Is that what you're asking?
Yeah, should I pump and feed at those times to keep it up, or because I have specific times that I do it. I do it at the same time every day at work.
But you're doing it about every 2 hours?
Yeah.
Okay. How often does your baby eat?
For me, every 2 hours. For his dad, every 4.
Okay.
He'll go longer for dad.
Because he's eating a lot more probably in the bottle than what he's eating at the breast.
Yeah.
Yeah. So here's what I would say to you. 2 things. One, what you're doing at work is absolutely perfect. And I just want to say, you know, I'm so impressed with what you're doing, and keep it up. Don't change anything. Okay. You're doing great. When you're home with your baby, I would breastfeed. Don't pump. Okay. You don't need to.
Okay.
You just put the baby to breast, let the baby breastfeed as often as he wants to. He's eating every 2 hours and kind of staying on the schedule anyway that you are. It may not be exact. It does not matter. Okay. But it's frequent feedings when you're home. Plus, like, you're at work 4 days a week. You want to make the most of those 3 days when you're home and not have to deal with your pump. You're dealing with it enough. Be with your baby, and he needs you anyway. So I would just do that when you're home. So that's the thing. The truth is that you're doing everything you need to do. You're pumping what you're supposed to be pumping. You're making a perfect amount while you're gone, and you should feed when you're home. Here's what I want to address. I want to address those long stretches while you're gone and big bottles that daddy's giving the baby when you're not around. Okay. I would say that, so how much does he feed the baby at one feeding?
He'll make a 4-ounce bottle and then just give him as much as he wants. Sometimes it's 3.5, sometimes it is 4. And that's when I get a little scared when it's closer to 4.
Okay.
He won't do more than 4.
Okay, but 4 ounces every 3 to 4 hours is not an abnormal amount for him to be eating. Okay, so that's actually good. He's probably just snacking more. He's eating less amounts when he's breastfeeding from you. He's controlling the feeding a little bit more and then eating more frequently. But the 4 ounces is not too much. What I would suggest is, do you know anything about paced feeding?
Yeah.
Okay.
Make sure the bottle and.
Yeah, you know, it's more like, I don't have my doll here, but it's more like there's a couple things you want to think of and you want to show daddy how to do. And that's making sure that the baby's controlling the feeding with the bottle more than the bottle's controlling the baby. Okay? That you're slowing down the feeding, that you're giving him a chance to catch up with himself, to take breaks, to burp frequently, that he's actually controlling it. And Joe went to get the doll, so here's my doll. You've got a live doll, which I wish I was holding your baby instead of this one, but I have to show you with this. So imagine, this has no nipple on it, but imagine this is the bottle. Sometimes babies are fed where they're horizontal, okay, and the bottle's vertical, okay? What you want to do is hold the baby more vertical and the bottle more horizontal. This is more of a paced feeding so that it's the milk is just filling the tip of the nipple here. Sometimes you even let the milk flow out of the nipple so that there's some sucking going on without any milk. The way that would simulate the same way at the breast and then start up again, it gives the baby those natural breaks that the baby will take at the breast too, and it'll slow down the feeding from just guzzling down 4 ounces really, really fast. Okay, if you do this, it's just pouring straight down them. And that is not how they breastfeed. That is not how they breastfeed. So sitting the baby up, holding the bottle this way, filling the nipple, allowing it to like drain out of the nipple, just a little bit of sucking, taking it out of their mouth frequently, burping the baby. And even when the baby's starting to, you go to put the nipple into the bottle into the baby's mouth, you're kind of, rubbing it against their lips the same way as with the breast, where you allow the baby to accept the nipple into their mouth instead of shoving it in. Okay, all those things of let him watch you breastfeed. Let him watch how the feedings go when you're actually doing it together, so he can get more of a visual of what he can start to do with the bottle to slow it down. Okay. That would really be one of my biggest suggestions, is to do that. And then if the baby starts to close his eyes and starts to sleep during the feeding, it's time to take the bottle out of their mouth.
Okay.
Okay. I would say that, and also when the baby's hands start to relax and they're eating with their hands relaxed and their eyes are closed, they're really at that point, if they were at the breast, they wouldn't be eating anymore. But with the bottle in, it just keeps pouring. And because of that strong sucking reflex that we talked about before, where the baby likes to suck, they'll just keep swallowing or they'll choke on it, right? So the milk keeps flowing and the baby has no choice but to swallow and overeat. And what that'll do is, make the baby cry, which then can lead to more feeding when it's the opposite of what the baby needs, which also leads to you feeling like you're not making enough because you can't pump more than what he would actually be eating when he was at the breast.
Okay.
The good news is you're doing everything right. How's that?
That's good. I'm happy because I got really stressed out on Wednesday and I almost started crying.
There's nothing.
Jess, I want to commend you so much because all of the moms here, breastfeeding is a full-time job, more than a full-time job. And you working 10 hours and pumping every 2 hours is really amazing.
Yeah.
You should
Thank you.
yourself. It's really amazing.
Thank you.
Totally amazing. It's not easy. It's so not easy. I wish that we had more maternity leave for mommies in this country. I wish that things were different where we could stay home with our babies, and I know it's not possible and that it's not, we need to work and we need to go back and thank God there's breast pumps and there's good information and then there's daddy who's there, all these things. But like Rachel said, I commend you. It's not an easy thing and you're doing it. And you're going to be so grateful that you did. As time goes by, someday you'll be looking back at this time and saying, I'm just, it wasn't easy, but I'm so glad that I did what I did. And it doesn't last forever. So good job.
I know. I really like breastfeeding. I did not breastfeed my first, but now I have a lot of support to do my second.
Wonderful.
I have yet to ever hear a mom say she regretted breastfeeding. No one ever says that.
No, it's fantastic. And I'm so glad that we have this community here where everybody can support each other and be here and we can answer these questions. Let's get big hearts. Jess deserves tons and tons of hearts for working mama who's doing so great and really doing an amazing, amazing job. So let's give her hearts, tons of hearts here. I want to see them flying across just take in all the love that's about to come because they're going to start flying right now. Remember, there's a little bit of delay. So there we go. All for you.
Thank you.
Fantastic. Yay. Okay. So what I'm going to do right now, real quick, okay, we're going to change the screen and go into like what we call Brady Bunch view. All right. Because we're going to try this out. Because look at me. I'm like the technical director here. All right. Joe's laughing in the other room. I did it. Okay. Woohoo. I did this. And we're going to unmute everybody right now. Hold on a second. Okay. Unmute everybody. All right. So now everybody can speak. Did everybody have a good time tonight?
Yes.
Yes.
Was this the best or what?
It was awesome.
I love it.
Love
My
it.
goodness, we finally got this to work, and I think this is going to be a regular for us. What do you think, guys? Live with you?
Yes.
Everybody, hashtag live with you. I want to see that come through the chat room right now. If you enjoyed tonight, I want to see it right now. Hashtag live with you. And when I announce that next time, you know what we're talking about. And we will probably be doing this every month. We'll be doing one of these live with you events where anybody who wants to come on, spend some time with us, ask me your question directly, show off your baby because we want to see your babies.
Love your baby.
All the baby love. Look at Let's put all the babies into the cameras right now. Aw, there they are. Oh, so sweet.
The screen and I'll hold your babies for you.
Oh my goodness. So cute. So all of our guests tonight won Rachel's Remedy. Okay, so everybody's gonna get a Rachel's Remedy, all right? And then everybody in the chat room, you just have to love this post, all your comments here. We're gonna pick a winner for the back buddy, and you guys can enter that too, okay? You can still, if you commented in the chat, you'll still be eligible for that as well. So anybody
And
who
you
would
can
like
pick
to
which
win
one you want.
What'd you say?
I said, and you can pick which one you want. We have a bunch of new covers that aren't even out yet that I could show you. I have a couple of them here.
You got a couple of them? You want to do it? Go ahead. Pull them out. Let's see. Oh,
have you seen this one, Shari? This is a brand new one. It is so soft, so soft. I love this one.
Oh my God. I love that.
And then ivory.
What colors you have?
That's the silver, and then I also have it in ivory, and the ivory is so pretty too.
I love it.
Then I have this one. I don't know if you can see it very well.
Oh yeah, look how pretty.
These are premium minky fabrics. These are like
they're the softest thing ever. The one behind me, I just love it. They're the most comfortable, soft, and Laura's just amazing with picking all her prints, and they're all so beautiful. And what's so nice about them is even after you're done, you can keep them in your family room, out in your house. They don't have to be like just in a nursery. They're just beautiful.
Yeah.
So, yay! Who wants to win?
So you get to pick which one you want.
Fantastic. Thank you guys so much. Thank you, Laura. Thank you, Rachel, for everything. Thank you, ladies, for joining us. Thank you, everybody in the chat room. Did everybody have a good time tonight? Yeah, they're all loving it there. Fantastic. And please don't forget to join me on Wednesday night for my amazing talk with Dr. Scott Siegel for lip ties and tongue ties. And then I don't think I announced it yet. All right, we're gonna do a reveal real quick right now. I have another amazing chat coming up on Friday night. Okay, I'm gonna be posting it. It's gonna be a little bit different. It's not gonna be here on my Facebook page. It's gonna be over on Belly and Breast. Fairhaven, okay? And I'll post the link for you guys. It is going to be a chat on how to do perineal massage, how to prevent tearing and episiotomies for labor and delivery for childbirth, okay? So we're going to pull out the midwifery hat, okay, my midwife hat for that chat, okay? We're going to get off the breastfeeding topic for a little while, and I have an amazing interview with Joanna Ellington, who is a sexual health expert who invented an amazing product with Fairhaven, and we're going to be talking all about that. If you're expecting, if you know somebody who's expecting, if you have any moms or friends who are about to have their babies, please don't miss that chat. It's super important. I mean, some of my best information that I can pass along to you after delivering so many babies, we are going to talk about it on Friday night, okay? So look out for the post on that, and make sure that you're signed up to get notifications from me so that when we go live, you get a reminder. Do you guys have notifications turned on?
Yes.
Yeah. So when I go, yeah, it makes it a lot easier, right? So you don't have to remember. It's like, oh, right, she's on. It tells you. So make sure that you hit the get notifications on my live chats, and you're and you know when we're live, okay? Thank you, everybody. Have a wonderful, wonderful night, and enjoy the rest of your weekends. And we'll see everybody soon. Okay. Good night, everybody. Good night.
Good night.
Thank you.